Bromberg and Asante Haughton. Welcome, you guys.
How you doing? How you doing?
We love a good origin story here in musical theater. How did you guys meet, and how did the Reach Out Response Network come to be? Before we get into all the nitty gritty.
Asante and I, we used to work together at Stella's Place, which is a youth mental health agency. And Asante and I, we had a lot of conversations about, I guess, the mental health care system and ways in which the crisis response system wasn't working. And at a certain point, we just thought, we could do something about this. There are probably other cities in Canada or the United States or other parts of the world that are doing a better job than Toronto is at responding to these kinds of mental health crises. So we started to do some research. We started to learn about what are the best practices in other parts of the world. And then we sort of thought, hey, we could bring this to Toronto.
So why is mental health care so, I want to say, inaccessible?
Well, there are a lot of gaps in the system. That's the simplest answer. Just historically, mental health has not really been like on the forefront of, a lot of people's consciousness, unless you were the person or, it was a family member or someone you knew who was going through it. Right. So, that's the first thing. I like how I got into the game was actually telling my mental health story because there was like nobody else out there doing it. So I kind of like had a corner on the market as like, yo, here's a Black guy from like the projects who talks about mental health. And that sort of propelled me here. But and that was only maybe 9 years ago. Right. And so a lot has happened in the past, several years. And nothing was really happening before that. So, we're doing all this anti-stigma campaigning, but the system has not really caught up to folks, wanting to access mental health services, I guess more robustly or more, or whatever the case may be. So if there are gaps, people don't know how to access, they can't find things that they need, they get the runaround. Maybe there are other challenges beyond mental health, housing, is a big one, substance use for others, a lot of different things, right? If there's no way to enter or to really, to do the prevention work, then you just get worse and worse and worse. And the next thing you know, you're calling 911 because that's the only recourse you got, because you're in such a high level of distress that, this becomes, wow, this is my only option. That's been me before. That's been family members. That's been people that Rachel and I have worked with. So, I mean, that's a big thing, but, why 911? And well, it's not the number really, it's the people showing up. Why the police? Right. Yeah. So, that's the question that we wanted to answer. And, I'll toss it over to Rachel to maybe say a bit more.
Yeah. So, I mean, what we really saw is that police have become like the catch-all in our society. Like basically, if you call 911, you get the fire, which obviously for a fire, ambulance for like physical health crisis. And then police are sort of tasked with doing everything else. But the problem with the mental health crisis is that it's the tools that police are bringing into the circumstance are not well matched to the situation that they're being called to handle. So, someone who's in a mental health crisis, what they really need is support and de-escalation and to be connected with resources. Whereas, when police show up on the scene, really, they're not mental health workers. And I mean, through no fault of their own, police are trained to respond to crime and violence and danger. Asante and I have been working in the mental health field for a long time. We've received a lot of training in things like suicide risk assessment or safety planning or appropriate resource referrals. We have, I think, both of us have a pretty good idea of what resources are out there to send people to, what are the benefits and challenges of these different resources, what kind of resource is appropriate for what kind of situation that someone might be in. And that's just, police don't get that kind of training to that same degree. And even if they did, their presence on the scene, because people associate police so strongly with like crime and violence and danger, them being there at all, even if they're nice, even if they're nice people, which sometimes sometimes they are, sometimes they're not, but even if they are, it still brings this association in people's minds that, oh, people in a mental health crisis are dangerous or violent or scary because of that association with police. So what we really want to do is make sure that the people with the right tools are responding to the right situation. So, someone who's in a crisis, we know from the data that very unlikely to be violent towards anyone. Like, we know that 89% of 911 related mental health calls don't involve any risk of violence to anyone and don't involve any weapons. Mm-hmm. So if you think about those calls, you don't really need a person who's trained in responding to violence and crime. What you need is a person who can do a risk assessment, can de-escalate, can do a safety plan, can figure out what are the appropriate resources to take someone to. And that person who is going to be a crisis worker, not a police officer.
I know, Rachel, you had mentioned that you'd worked with people who had felt criminalized by the response of 911, and that's enough to make someone never want to call for help again. Like, that has to really affect negatively, especially if you're dealing with anxiety or especially in a crisis. You never know what kind of mental state someone's going to be in. Can you speak to that part of the experience with people that you've worked with, and like the importance of that response?
Yes, I mean, in the work that we did, so over the summer last year, we worked with the city to do some community engagement. We did some town halls, a lot of town halls, and also just in terms of like my work with suicide prevention service in the past. Like, I've heard a lot of stories of people who, police showed up when they were in a crisis and, were taking them out of their home in handcuffs in front of their family members, in front of their neighbors, and not because they'd done anything wrong, not because they were violent, just because they were in a suicide crisis. And that's standard practice a lot of the time when someone is in a crisis. And, people talking about, okay, well, I was handcuffed, put in the back of a police car. I felt humiliated. I felt like when I came back, like, how am I going to face my neighbors after they've seen me being put into a police car in handcuffs? Like, they're going to think I'm a criminal. And, we recognize that people who experience mental health challenges have often experienced trauma in their lives too. When you think about like having, people you've never met, often like large men with guns, like putting their hands on you, handcuffing you, physically taking control of you. Like, it's really scary.
Yeah. Absolutely.
And that's when you're already in a moment of crisis. You're already feeling escalated. You're already thinking about dying. And this is the response that you're getting.
Yeah.
Yeah. Can I add? Yeah, real quick. There's also the other part where, some folks who are criminalized, even without having a mental illness or not going through the system, you're not wanting to call 911 either. So like for me as a Black person, that's not necessarily a comfortable decision for me to make. Or if you live in a low income neighborhood, having the cops show up at your doors is kind of, putting a target on your back in a lot of ways, depending on what else is happening in that community. Right. So, there are a lot of considerations that, go into making that call. And, Rachel and I, something that we've talked about a lot is being in the position where we've had to make some really tough decisions about whether, as professionals, about whether or not we make that call, because we're afraid of what might happen to the person that we're trying to support if we do. And we shouldn't have to be put in that position. We should be in a position where we can call for help and know that help is going to arrive, and that help is what the person in need is going to get.
Mm-hmm. And thank you for addressing that, because that is a very important thing to mention. So this new pilot project that will happen in 2022, Rachel, I believe you said, what can you tell us a bit about that? And yeah, tell us about this, because I think this is so amazing that this is something that's going to be happening in our city.
Yeah, so there are going to be 4 different pilots that are going to be live in January of 2022. They're going to be in 4 different parts of the city. So one is going to be in downtown East, one will be in Northwest Etobicoke, one will be in Northeast Scarborough, and one is going to be specifically an Indigenous-led pilot that will be run by Indigenous communities and will serve Indigenous communities specifically. And that one, it will have a geographic catchment area, but it hasn't been set yet what that will be. So what's going to happen is agencies in each of those catchment areas can apply to operate the service, and then one agency in each of the areas will be chosen. And once the pilots launch, rather than police showing up to some of these mental health crises, this teams of mental health workers, crisis workers from these agencies will instead go out and they'll be first responders to these kinds of crises. And people will be able to access the service. There will be a transfer process from 911 if someone calls 911 and they're talking about a mental health crisis in one of these areas. But people will also be able to call the service directly if they know that it exists, and there will be some public education that will be happening in those catchment areas to let people know that this new service exists and people should call it.
That's amazing. What is kind of your hope with this pilot project for the future of mental health response in Toronto?
For me, it's pretty simple. The hope is that people who are in distress get support and useful support that will put them on a path to getting better than where they were at when the call was made. So for me, that's the number one thing. There's obviously a lot of other stuff embedded there, but it's just about making sure that people who need help get it, and then that's a starting point for them to get better.
On behalf of myself and everyone watching, thank you for the work that you're doing in our community. It's so important, and it means so much to us that you took the time to speak to us about it. My last question, I guess, is if someone watching right now, either themselves or someone they care about, is facing mental health crisis, they're not sure what to do, they don't maybe want to call the police because this project hasn't been implemented yet. What would you recommend as a maybe a resource, or what should they do if someone is in crisis right now and they're not really sure where to turn?
So one resource that is a really good resource for folks who live downtown Toronto is the Gerstein Center. That's an organization that has a mobile crisis team that can go out and meet someone wherever they are. They also have crisis beds, so if people need a safe place to stay but don't necessarily need to go to a hospital, they can access those. So I would encourage anyone to look up the phone number for the Gerstein Center. I would also say that there are suicide prevention services like Canadian Suicide Prevention Service or the Toronto Distress Center that people can access. But I would also say if you're someone who's worried about a loved one, often just talking to them and supporting them and letting them know that you're there, and trying to also, as much as possible, encourage them to create how would I say, I guess, a group of people who they can call on, who could sort of, rather than just having one person who they're relying on all the time, really encourage them to create a group of a few different people who could support them in a crisis, or even before it gets to the point of crisis. And sometimes it can be difficult to talk about, especially people who are experiencing suicidal thoughts. That can be really difficult to say. So if someone has trusted you enough to share that with you, offering to support them and telling other people if they are comfortable with that, if you could have a conversation with them, that can be really helpful. But really just letting the people in your life know that you're there for them, that you're not going to judge them, and that it's safe to talk about this stuff with you. That is something that is really important.
Mm-hmm.
Yeah, and just to add to what you just said at the end there, Rachel, sometimes, and I've been in this position before, and I've made this mistake, is when you want to support someone, you kind of turn every conversation into a support conversation, right? So that's not necessarily a useful strategy. Sometimes the best way to be there for someone is actually just to be there for them, and not necessarily focus every interaction that you have with them on whatever the challenges that they're experiencing. And to try not to see that person through that lens of, oh, they're suffering, and you just start to implicitly treat them differently, and they feel that, right? So really just focus on the whole person, and still being there with them in a way that you would be there with them if everything was going fine. That's not to say that you avoid the conversation about the mental health challenge, but just not to necessarily make that the main focus all of the time. As that can sometimes, make folks close up and drive them away, which is not what you want people to do. You don't want them to feel isolated. You want to open up, like Rachel was saying, networks of connection for folks, because we're social creatures as humans, and ultimately, connection is what keeps us going.
Absolutely. And that's so much of the reason why we're here. So thank you for that. Rachel and Asante from the Reach Out Response Network, you can go to their website, reachouttoronto.ca, catch them on the Instagram or the gram. The cool kids are, I don't know anything about being cool.
IG.
This is where you can find them on Instagram. Both of you, thank you so much for the work you're doing. Thank you for taking the time, and we look forward to seeing this beautiful change that's happening in our city that you are such a big part of. Thank you so much.
Thank you so much.
Thank you.